So you're
Timing starts.
yeah, timing will start in 3, 2, 1, go.
I'm going to do hand hygiene, and I'm going to put on my gloves. I'm going to clean my stethoscope, and I'm going to check patient ID. And sorry. Hi, I am Satyanvi, your student nurse today, and I'll be doing a full head-to-toe assessment on you. So basically, I'll be assessing your head, your chest, and your abdomen. Are you fine with it?
Yeah.
So before we start, do you want to use the washroom?
No.
Are you comfortable right now? Okay, so let me provide you with patient privacy. I've drawn the curtains. And now I'm going to start with a general survey. So first, I'm going to ask you a few questions. Are you fine with it?
Yeah.
Can you say me your name?
Miso.
And do you know where you are?
Senate College.
Do you know what day it is today?
Tuesday.
So as you can see, her level of conscious, she's alert and awake, and she's oriented ×3, which means she's oriented to the person, time, and the place. And now I'll be moving to physical appearance. Her physical appearance tallies with the age stated, and I did not detect any odor on her, and her skin color is consistent with her ethnicity. And now I'll be moving on to body structures. So her height is such that. So can you stand for me? So yeah, thank you. Sit down. So as you can see, her height is appropriate to her age and her BMI. I think. Yeah. Sorry. And she doesn't have any physical deformalities, and her posture is upright, and she's sitting. And her head is erect. And now I'll be moving on to behavior. So as you can see, her facial features, I can see involuntary movements, and she seems relaxed, but she just seems a bit moody though. And her speech was clear, and she's dressed appropriate, and she's dressed appropriate, and she has good eye contact, with good visual coordination. So that's her behavior. Now I'll be moving on to the face. So I'll be first inspecting your face. So let me inspect. So I can see that her skin is consistent all over her body. It matches her body and her face. And I could see there's no lesions, no scars, no swellings in either sides. And yeah, so that's the inspection for her face. And now I'll be testing cranial number 7, which is facial cranial nerve. So before that, I'll be telling you to do some like silly kind of gestures. Are you fine with it?
Yeah.
So can you smile for me? Can you show your teeth? Can you open your eyes? Sorry. Can you close your eyes? Oh my God, can you clear that? So can you lift up your eyebrows? Can you puff your cheeks? Okay, so now I'm going to test the cranial number 7. So you just have to close your eyes, and I'm going to apply resistance on your eyebrows. And you have to make sure that you don't open them, okay? Okay, so from that, it concludes that her cranial nerve number 7 is intact, and all the movements were symmetrical in her face. And now I'll be moving on to her eyes. So first I'll be inspecting her eyes, and yeah, so I could see that her eyebrows are evenly distributed on either sides, and they are symmetrical. And I could see that her eyelids have no lid lag, and her eyelashes are evenly distributed. And also I could see that her sclera is white. And let me just check your conjunctiva. I could see that her conjunctiva is pink, and I don't see any drainage from her eyes. So that's the inspection. Now I'll be assessing cranial nerve number 3, which is oculomotor. So first I'm gonna check the pupil size with this pen light. So her cranial number, her pupil size is 5 millimeter, and her eye pupils are equal, and her shape and they're round in shape. And now I am going to test whether her pupils are reactive to light. So so her pupils are reactive to light. And now I'm gonna check for accommodation. So can you just focus on this? And you can focus on this when I get close to you, okay? So I saw that her pupils converged and they got closer, and so that means she has good accommodation. And now I'll be testing the reflexes, which is direct and conceptual light reflex. So first, I'll be checking the direct one, okay, and I'll be checking the conceptual one. So okay, so her direct and conceptual light reflex are intact and they are present. So that's it for the eyes. Now I'll be moving on to her ears, which is let me put the hair down. So the shape of both of her ears are symmetrical and they're similar, and her external ear is aligned with the eye, her eyes, and I don't see any drainage of her ears, so her ears seems good. Now I'll be moving on to her nose. So I can see that her nose is midline, and I don't see any flaring, and her nares are patent. So now I'll be moving on to her lips. Her lips are, I could see her, now I'm gonna inspect her mouth. And also in her mouth, there's two cranial nerves, which is glossopharyngeal is the cranial nerve number 9, and vagus is cranial number 10. And there's another cranial nerve which is 12, which is hypoglossal. And now I'm going to inspect her lips. So her lips are pink, they're a bit dry though, and her shape is symmetric, and there's no lesions, no scarrings on her lips. So now can you say ah to me? Okay, so when she said ah, I could see her vulva and her soft palate rising together symmetrically. So that means her cranial nerve 9 and 10 are intact. And now I'm testing cranial number 12, which is hypoglossal. So can you stick your tongue out, and can you turn it, move side to side? And can you say light, tight, dynamite?
Light, tight, dynamite.
So I saw that her tongue is midline and there's no tumors, and she said the words correctly. So her cranial nerve number 12 is intact. So now that I'm done with her mouth, I'll be moving to her neck. So I'll be inspecting and palpating at the same time. So I'm going to palpate one side at once. So the skin is evenly consistent throughout the body. There's no enlargement of thyroid, and I did not feel any masses, and there's no lesions, and I felt her temperature, it was warm. And what else? There's no scarring. And her head position is erect with her tracheal positioning. And now I'm gonna test cranial number 11, which is spinal accessory. So I'm gonna tell you to shrug your shoulders, and I'm gonna put resistance on you, so you have to make sure you don't put it down. And can you rotate your head? And also I'll be telling her to look this side, and I'm gonna apply pressure. And same. So when I did that, so that concludes that cranial number 11 is intact, and because all of her movements were symmetrical, like her shoulders, one of her shoulders did not go down, so it was intact. Now I'll be moving on to her thoracic and apical pulse. So first I'll be going to inspect her posterior thorax. So I can see that the skin is evenly consistent throughout her body, and I don't see any skeletal deformalities, and I see that the symmetry of the body is symmetrical, and I don't see any lesions nor any scarrings, and I don't see, yeah. And now I'm gonna palpate. So I'm gonna use my palm and palpate. So I'm gonna start from here to, and when I palpate, let me know if you have any pain, okay? So when I palpated, I did not feel any masses, or I did not feel any tenderness, and all the palpations on both the sides were symmetrical. now I have to inspect I'm gonna auscultate her lung sounds now in her posterior thorax. So I'll be using my diaphragm and going in the same route. And can you take a deep breath whenever you feel like pneumonia? So I could hear clear lung sounds, and there was no cracklings, and it was clear, and I could hear the I could hear I could hear high pitch vascular sounds, and I could hear moderate bronchiovascular sounds, and that's in the posterior thorax. Now I'll be taking her apical pulse. So first, apical pulse is in the atrial valve. So first we have to landmark. So it's in the apical valve, atrial valve, and it's in the 5th intercostal space, and it's in the left mid-clavicular line. And so this is her left. So it's here. And now I'm going to auscultate. I'm gonna use the diaphragm to get the heart rate, and I'm gonna listen for 30 seconds. Her heart rate was apical heart rate was 76 breaths per minute, and the rhythm was regular, and it was unlabored. Now I'm going to see if I can hear the S1 and S2 notes. So I'm going to use the bell for it. Yeah, so the S1 and S2 was heard clearly, and the abnormal findings would be like wheezing sounds, crackling, and gushing sounds or throbbing sounds, but I didn't hear any of it from when I auscultated the apical pulse. Now that I'm done with that, I'm gonna move on to the abdomen. So can you take your shoes off, and I'm gonna let the patient also position, and I'm gonna slide a pillow in to her under her knees so that I could get accurate results, and I'm gonna cover her appropriately. You're a good mom. And so now I'm gonna inspect her abdomen. So in her abdomen, I can see that the skin is even, consistent throughout the body, and I don't see any scars nor any lesions, and I could see that the umbilicus is midline. And now I'll auscultate because I don't want to palpate before I auscultate. And I'm gonna auscultate on all the 4 quadrants. So I'm gonna start with lower right quadrant, and upper right quadrant, left upper quadrant, and lower left quadrant. So when I auscultated, I could hear vowel sounds in all the 4 quadrants, and it was present. So it was all present, and I could hear them clearly on all the 4 quadrants. And there were the frequency was 5 to 30 per minute, and normative, and I could hear that it was gurgling irregular and gurgling sounds. Now I'm gonna palpate. So I'm gonna palpate in the same route. If you have any pain, let me know. So when I palpated, I did not feel any tenderness, and she doesn't feel any pain, and I did not feel any masses. And that's the end.